to the Slack after our meeting. So sometime in the next week or so, you'll get an email with all the materials from today, and we post them as well in Slack and on our website. All right, meeting logistics and collaboration agreement. This is pretty standard stuff. Just a reminder, love to see your faces. Video is always strongly encouraged, but not required. Again, we do record the sessions, and if you can, enter your name and your organization's name on your window so that we can all get to see each other and know which organizations we are all at. Lene, no problem about the video on soon. We all know that for the vast majority of us, we work more home than we do in office these days, and part of that means that there's animals and kids and everything happening in the background. So recognizing that not every day is a share a video day. So all right, we'll go ahead and get started. Next slide is our collaborative agreements. I won't go through them in detail, but we will continue to talk about them in the beginning of our monthly meetings. Here's our agenda. We did send our agenda out in the Slack channel ahead of time. We're going to try to continue to do that. Let us know, either, we're a small group, so feel free to come off of mute. I'm trying to balance, adding another email to everybody's inbox, but also recognizing that not everybody's a fan of Slack. So, we're trying to strike a good balance there. All right, instant replay, what have we been doing? So really quick, just a reminder of what June looked like. We had our June CPI meeting, and in that meeting, we talked about a network scan or network assessment. We had folks who participated in the June meeting volunteer to pilot and give us some feedback. We collected that feedback and made some changes to the network assessment. We're going to talk a little bit about that, the next phase of that in today's conversation as well. We also went through our brainstorming sheet. That was that Google document where we broke out into different groups and talked about different things that are happening in the community, pain points, where we saw opportunities, and what we might be able to do together to influence or to change a process for the better. Nicole, we will, oh, look at that, Emily. You just knew, you just were reading Nicole's mind. All right, so we voted last month on referrals as being one of the priority areas, or the priority area that we want to focus on first. And we talked a little bit about, and I think the next slide kind of highlights what we're thinking we want to do, at least initially, to collect data and then kind of look at that data with our network map. And then get into that fourth row there, which is, how do standards relate to current workflows? What could we do to level set best practices and client engagement? So the first thing is really mapping out the current referral process for both ECM and community support services by category. And we'll talk a little bit about that in this next phase as part of today's discussion as well. All right. Next slide, please. This is just a reminder, and we'll include this obviously in all of our presentations, because it's required, but also it reminds us and centers us as to why we're here. We know that the vast majority of you are busy in back-to-back meetings all day, every day. And so first of all, appreciate your time and your commitment. And the commitment itself is really about coming together for the betterment of and for the success of CalAIM. What can we do? How can we institute CalAIM more effectively? Where are there pain points that we might be able to make change? Looking at quality outcomes and health disparities and diversity and the delivery system itself, and where are we seeing their gaps? that we really need to focus on filling. All right, let's get into it. And we'll start with next month. So it's been 6 months, we're in our 7th month of getting together, and we would like to have an in-person meeting. The meeting is not meant to replace what we normally talk about in our monthly meeting. It is meant as an in-person design session, and we'll talk a little bit about what we're thinking for the agenda. But we wanted to do a couple of different things. We wanted to leverage the folks here today to really help shape our in-person event. And then we also wanted to get a sense of where folks were the last week of the month of August. And so we've proposed 2 potential dates, and we're going to ask you all to vote on your preference, and then we'll go with group consensus. We're looking to try and do something in the morning on the 28th or on the 31st. And then just calling out Lene and Contra Costa Health for graciously offering to host us. So we're really excited to have that happen. We'll work with Lene and team on sharing some additional information after today's session. But we really wanted to use today to discuss the topic in more detail, get some feedback from the group, and then also get some feedback on the date and time. All right, it looks like 60-40.
And really quick, for those that just joined, because I saw at least one person just joined, we are having an in-person meeting for August. It'll be like an in-person design session. Right now we're voting on which of these 2 days best work for your calendar. And we're 50-50. So if you haven't voted yet, you can be a tiebreaker.
Oh boy, guys, you're really making this difficult.
It's still 50-50 for those.
It looks like Holly just joined. I think we should have Holly be the deal breaker.
Claudia, thanks for putting 8:31 in the chat. Thank you very much. Yeah, if you can't for some reason participate in the poll, whether you're on your phone or whatnot, feel free to put in the chat the date that works best for you. So 8:28 or 8:31, both from 9 to 12.
Oh, good call out as well, Lene. The meeting location will be in Concord, if that helps determine the best day. Fair enough, Amy. Okay, we'll put that together. I didn't see how we landed. I don't know, Emily, if you want to call it out, but we will put that together. Okay, it looks like 8:28 seems to be the group consensus right now.
But I think with Amy's change and Claudia's vote, we're probably split.
Back to 50-50, aren't we?
Yeah, so I think we can maybe take it offline and make a decision.
Yeah, that sounds good. We can also try and put together a little Slack poll to see if we can get some additional feedback. The next thing we wanted to talk with you all about, in addition to coming together in August, is the topic of discussion. Holly, okay, no problem. Mint chocolate chip, that is a good flavor as well. That's a staple. Mine's still coffee, hands down. For those who just joined late, just a reminder, we're talking about an in-person event in August, at the end of August, the last week of August. And so we're looking at voting on which day works better, Monday, the 28th, or Thursday, the 31st. And the meeting will take place in Concord. So thanks again to Lene and team for hosting. And we will circle back with some more information once we've got that finalized. And let's start now talking a little bit more about our activity for August and get a temperature check from you all to see if that's something that would make sense. If you have other ideas that you'd like to talk about when we come together, that would be helpful to share as well. So the intent behind August is to have a design session, really getting in with real Post-it notes and Sharpies and spending some time coming together, thinking creatively about the referral process and the way that our patients and our clients engage. So not only talking as we have for the last several months about our experiences, but also looking for a way that we might be able to bring in the voice of our clients and also add in, you know, how you're wanting the system to work for your organization and for the clients that you serve. Sometimes this is called an empathy map, but it's really about bringing in more perspective. And so it's been, I think, and it sometimes can be to actually bring clients to the table. We've, I think, tried a little bit in some of our initial outreach. But in lieu of that, you all are interacting on a day-to-day basis at some level with the clients that you serve, whether it's face-to-face or just in the work that you do in the organizations that you're in. And so it's really trying to bring our own perspective to this workflow and thinking about, you know, what we would envision this workflow to be at its most successful. And then sort of working our way back, and we'll talk a little bit about some of our workflow mapping, you know, working our way back on, you know, how do we then take, you know, that experience and apply different levers of change, right? So looking at, if this is sort of the ideal state, what are some things that we need to kind of tug on in order to make some changes? Some of those we already know, we've been talking about for the last several months, but it's just a different way, I think, for us to look at those things and see if we have more of the story that can drive us forward. So just wanted to get a reaction, a temperature check from the folks on today's call. That sounds like a meaningful exercise. Any? I see a couple of thumbs up. Great.
Looks like Lene, you have your hand raised.
Yeah, I was just wondering, this referral process with like the new things coming forward in January, for example, and with the closure of like our TCM programs within Contra Costa County, specifically in Contra Costa Health, and that transition for the children and youth population, I feel like part of this referral process is also connecting or warm handoff to the Kaisers or the Blue Cross or whatnot in the next couple of months. And so that was the other conversation that I'm hoping this referral process can include as well. Warm handoff / referrals as well.
And Lene, just so I'm crystal clear and tracking what you're saying. So in light of the 2024 managed care plan transitions and Kaiser kind of shifting the relationship in Contra Costa County, is that what you're speaking to specifically? So including that as we're mapping out future state referrals, including that.
Yeah, I would say, how do we receive them? How do they, and then also with the we're still waiting for updates on this foster population, but kind of like if we have to transition people in that way, and like how do we have that approach and that referral process to be client-centered and patient-centered, so we're not just like dropping people and they fall through the cracks.
Yeah, that all sounds good. And I think there's a couple of slides, we have some initial talking points or thinking points on some of the questions, but this is part of the conversation we want to have today, is how do you want to design the questions to get at the referral process, and what do we want to focus on? When we say referral, what exactly do we mean, and how do we want to map that? So all of that I think sounds great. And we can definitely, I think in theory, include some of that. Jonathan, I'm glad you raised your hand, because I was going to ping it over to you and see if you had any thoughts or reaction. Is there anything you want to add to that? Does that sound okay to start conversations about 2024? Is it too soon? Just reactions generally to that conversation.
Sure. Yeah. And good morning, everybody. Jonathan Artamani. I'm a consultant with Kaiser Permanente. I work on a statewide Medi-Cal team, and I've been supporting IPP and PATH for a good amount of time now. So it's good to see some familiar faces. So I'm all, let me say it this way. I am always in support of transparency and making sure that whatever processes we are setting up as managed care plans work not just for us, but also for the providers that are seeing and serving our members. My only concern, and I'm curious for some feedback from my other MCP partners, is I almost feel as though maybe amongst the managed care plans, maybe we should have that preliminary discussion first, so that we can kind of frame how we want to approach it, and then maybe coming back to this group, maybe not with the recommendation, but kind of sharing an update to say, hey, amongst the managed care plans, we understand that there's going to be a couple of changes coming in 2024. Here's how we're thinking of approaching it. Here's some potential impacts. Here's how, kind of even sharing some of the guidance we've received from DHCS around what we need to do and what they're expecting us to do to support our members through this transition. I'm I guess concerned about our ability to have those, and there's a lot of detailed discussions that need to happen. And I'm not sure if this in-person forum is really the best one, but if it is, and if all my other MCP partners are open to it, we can certainly take that back. But that's just kind of my initial concern with that. So open to feedback if the other folks have any input on that.
This is Elena. Oh, sorry. Go ahead, Lene. Okay, this is Elena from Anthem. Yeah, Jonathan, I think I would echo a lot of the comments that you made. I think we are reviewing guidance and kind of figuring out what that means for everybody. And so I'd rather be able to have kind of like an informed discussion once we've had an opportunity to kind of meet and kind of really be able to express more kind of what the plan is. But I do recognize folks' interest in getting those discussions, on the table, and kind of being at the table for some of those discussions, because I'm sure this is anxiety provoking for some, but I'd rather be able to like kind of walk into a discussion with everything kind of laid out once the plans have the opportunity to meet. And I know Anthem is meeting with CCHP in the coming weeks, and Jonathan, we can connect about what would be appropriate for connectivity with Kaiser around that.
I was just going to answer and say, that sounds wonderful. Honestly, more like once you guys figured out more guidance for us versus us trying to like make up things is wonderful. But that's what I would prefer.
I also think it can be a both and. Like I definitely agree with alignment from MCPs and having that conversation amongst yourselves and helping to kind of direct and drive the conversation. But there's other components, with part of what we're going to be doing is breaking down some potential changes into very small steps. And I think as we learn more about individual processes and how each organization takes in referrals, there's also components of like, Lene, for you and your team, are there things specifically that you could do that would help your internal process? Maybe yes, maybe no. So in having some of these conversations, I feel like working from both sides for each individual organization, are there things that they can do to help support and streamline referrals within themselves? And then collectively as a system, how can we streamline, coordinate, and help refine that a little bit more? And that, for that conversation, having the MCPs at the table helping to really define and drive makes a lot of sense to me. So, what I would say is yes, definitely. And maybe it's a both and conversation.
And just the one thing I want to make clear, I think, we've started to engage in conversations with some of the providers and counties in which we're going to be exiting out of. And it's been really great to hear from them, just kind of like their concerns, some of their things that they're thinking about. So, as much as that, your concerns can help inform our conversation, because sometimes it just brings up blind spots. And to your point about just like things that are unique to your workflow that like are really kind of keeping you up, kind of thinking about, well, what does this all mean for us? I just want to, as an MCP, I just want to make sure that communication is super open and you feel that you all can kind of, reach out to me, just so these are things that are on our radar, because the transition is going to be a heavy lift for all. And I think that, so we recognize that. And so just want to make sure that you all feel like you have the space to kind of communicate your concerns, so we can kind of incorporate that into our planning processes.
This is Jonathan again. Just one more question. I wonder if, and I don't know if it's too preliminary, but I think that just as involved kind of area of work within CalAIM is complicated, involved, and there's a lot of players involved. I don't know if it's too early to have those discussions, but I think we would kind of maybe benefit from some info sharing on maybe what connections have been made today in Contra Costa County in preparation for the Just as Involved initiative. Again, I don't know if it's really appropriate for the August meeting, but it's something we have on our radar. Not sure if you guys have any thoughts on that.
Yeah, we're definitely having those conversations, Jonathan, and I think we're trying to plan for that pre-release and working really closely with the HSD within our bureau, like within Contra Costa County Bureau, and trying to figure out that piece. Emily Parmenter is one of our project managers who's really working closely on that. So if we do decide that that's the direction we're going in for that in-person meeting, I do feel like inviting, like, I wonder if we can clarify like what we are talking about, because I think there may be a good role, like if we do talk about that, for her to attend to kind of speak to what we've already been working towards for on our side as well.
Yeah, and I think that that's kind of the point of this conversation right here, is to really kind of define and finalize what we collectively as a group want to talk about. So there's a couple of things that I'm hearing. So one, our pitch was to do some designing around referrals, because that was the kind of area of focus that we voted on last month as like our first PDSA. So that is an option. We could also have a conversation, or instead have a conversation on MCP transitions for 2024. I heard that coming up as a topic of interest. What are the concerns? What are the things that people are focusing on there? And then justice involved. Those are kind of the three primary topics that I'm hearing bubbling up as potential points of conversation. The meeting is 3 hours. Yes, 9 to 12. I can do math. So, we have a little bit of time to have a couple of topics if we want to try to do maybe 2 of those, but I wouldn't want to put too much content in, or too many different topics in, just so we can really dig in and spend some focused time on an area. So with all that said, how are folks feeling? Is there one that's bubbling up as pressing? Is it justice involved? Is it 2024 transitions? Is it workflows? Is it something else we haven't talked about?
We only get to pick one.
You can pick 2.
I'm just kidding.
What's
Hard. I mean, I feel like the justice involved is a 2024 transition, given the pre-release coming January. So that's like the hard part. I think we just have a lot happening in January, and that's where I think us as like for ECM providers are feeling a little bit more of that pressure for those purposes. But I do see currently work that needs to be done on referrals and like what those processes are. So I can go either way. but if other people have strong opinions.
Holly's saying 2024 transitions along with referrals.
And maybe, maybe what we can do as well as we look at the rest of the year too, you know, we can spend more focused time in September, depending on where we are with the managed care plans and transition planning. So we can, you know, include that in our discussion for August, and then maybe depending on where things are, have a more focused conversation on that as maybe a sole topic for September for our monthly meeting, or October if we're not ready to have that conversation in September. Although that October gives me a little bit of heart palpitations because that's 3 months to make the change, but recognizing also that it's complex. Thoughts on that? Do we feel like, I guess my question, a better way to phrase it is, do we feel like if and when we come together in August, that we could have an engaged or informed discussion about 2024 planning? Or do we feel like we might not be ready to have that yet?
This is Jonathan with Kaiser. I think by August, just to kind of level set with everybody, right? So we have a transition guide from the state. So the state has told us, managed care plans, here's what we expect you guys to do. Here's some kind of general timelines by which we expect you guys to do it. So by August, I think we can come to the table and have a conversation about what the expectations are, and maybe bring a little bit of perspective on how we're approaching it, or if there are any nuances. And I think it would kind of need to be kept at that level. Just speaking for my organization, we are a delegate plan partner to Contra Costa Health Plan today, right? So we have a separate track, we have a separate working relationship with them where we kind of work through these details and information about what the requirements are, and maybe bring a little bit of MCP specific perspective, and maybe have an opportunity to hear from providers about what their concerns are, and that can maybe help to inform how we as managed care plans approach this transition and what we need to kind of communicate back to this group. But I don't see us being able to have really detailed discussions on, here are going to be the changes in referrals, here are going to be the changes like in operations. I don't think we'll be ready to have those like specific items by August.
Yeah, I think that kind of aligns, Jonathan, what I just put in the chat is, if we have a conversation on 2024 transitions, it could be kind of twofold. One is, let's collectively as a group kind of brainstorm some of our questions, some of our concerns, not to be answered in real time, but to kind of document and have that as a bank that we can share out after. So as 2024 planning and transition planning goes along in the fall, you have those in mind, we have those in mind, and we can start to dig into some of those answers over time, but we won't commit to having those answers in the meeting in August. And then there could be a high level kind of presentation discussion about the approach from the plans, keeping it at that level, Jonathan, that you're speaking of, where it's not getting into the specifics necessarily. It's just starting the conversation and we dig into the specifics over the fall. Does that sound fruitful to folks? And Jonathan, not to put you on the spot, but do you feel comfortable with that approach from kind of your perspective, KP's perspective?
Yes.
Yeah, and I think also just like right now from the guidance that we received from the state, there are just some like guiding principles that we need to, and policies. And so I think just like at minimum, just providing a overview of that, just kind of as it relates to some of the concerns of this group around continuity of care, kind of what does that mean for, just various things. I think that would be super helpful to just provide like a high level overview, because maybe a better understanding and I wouldn't imagine that everybody's read the guidance from the state, but I think just kind of providing that framework, so people can kind of it would be helpful to understand kind of like what are some of those elements that folks are bringing up that are kind of dictated within the DHCS guidance that we're working around. That may be helpful as well, just for people to better understand that these are things that are currently on the radar.
Great. Quick pulse check from others on the call, any of the providers or non-MCP partners. Does that sound like a good topic? So 2024 transitions as proposed. So brainstorming questions and concerns, high-level overview of the intent. Sarah, can I call on you? If you're around. Does that sound like it might be of interest for you? Yeah, okay. Anyone else? Holly, I see that sounds good. Okay, so it sounds like consensus that that's definitely a good topic to focus on. So we'll take this back. We'll do one more kind of assessment of the agenda and push it back out to you all via Slack. With enough time where you know kind of what we'll be talking about, and also to know if there are partners that you want to bring into the room that are not currently a part of this collaborative. I would encourage you to do that anyway. We're definitely always looking to make sure that we have the right people in the room. So if there are others that should be here because they're a part of something now or will be a part of something in 2024, feel free to invite them to the in-person and just to these monthly meetings in general. So we will take this back, finalize the agenda, and push it over to you. Yes, so just I got a quick message that some people have firewall issues with Slack. We'll also make sure to share via email as well. Thank you for that. Okay, next slide, Emily. Okay, so actually, sorry, go back, if you could go back to that last slide. So I think one of the things we had talked about doing is workflow mapping. It's a question mark now, or some design around workflow. But if you go to the next slide, Emily, it was the area of focus that was decided on at the last meeting. So I do think that we should still move forward with a plan that we had initially come up with, where we are asking for volunteers to try to start some of those conversations around what's your workflow, what's your referral workflow for your organization. So this is kind of the bottom up conversation that I was talking about of each individual organization or grouping of organizations. What does your referral process look like? So we can start to kind of document current state. The conversations with the MCPs around what will it look like in 2024 with some of this new guidance can still happen. There can still be alignment kind of from the top, but this will work from the bottom up. So what we're proposing is that, over the next month or so, we are asking for a couple of volunteers to have a conversation with us around referrals, and we will spend some time mapping out those referrals. Emily, can you advance so the other bullets pop up? So some of the conversations or some of the questions that we were planning on asking was really kind of big picture. Tell me about your referral process. Who sends you referrals? How are they received? Are you only getting information around eligible clients from MCPs? Can clients self-refer? Do you refer from partners? And what does that look like? Are these electronic? Are these fax? Like what is the process for you and for your organization? How are you communicating? Once you get that referral, what happens next? What do you do when you get that referral? Do you have the data that you need to understand next steps? Do you have other information you need to try to gather? Are there gaps or challenges with the referral that you receive that you're trying to, having to backtrack 3 steps to try to get a lot of information? Where do you keep those referrals, or where are those referrals received from? Do you have a shared data platform? I know a lot of you, especially on the ECM side, with Contra Costa Health Plan, you're all on Epic. But what does that look like for other ECM providers? What does that look like for community support providers? And then when you bring somebody through the program, so whether it's ECM or specific community support, so medically tailored meals, for instance, what does that look like? What are the steps that you're taking? And then how do you transition somebody out of your program? And what does that look like on the back end? So really wanting to map out that process with some of these key questions as our guiding kind of principles as we're talking through what it looks like for your organization. So I'll pause and see if there are any reactions, any questions you think we're not asking that we should be. Do these questions not seem useful or relevant at all and don't really get at what you were thinking about when we had talked about referrals last month? Anything else to add? Do you love them or slight modifications here or there?
I guess the only thing I would say is what happens after you receive a referral, that's like whether you deny or you approve, right? That would include both.
Mm-hmm. Yep.
And like how you communicate back, for example.
Yep. And then also like, what are the steps that you take high level internally at your program? Jonathan, I see it makes sense to you. Thank you. Any other thoughts, comments?
This is Tara from Anthem. You know what I'm always curious about is the time frame of the referral happening to the actual service being, the authorization that, like that process timeline.
Yeah, that's a really good call. That as a prompt. So thank you for saying that, Lene.
And then is this the assumption, or is this like across the board, including like our managed care plans, Anthem, CCHP, but like in my eyes, it's like once it's authorized, I can talk about that process. But I like the timeline between when the referral is submitted and it's authorized by CCHP on our end, that would have to be answered by them.
Yeah, and I think it's like if you have anything you can add to that, great. But yeah, that makes sense to me.
And then I guess my next thought would be like, is there an anticipation that I know that there's no one from CCHP here today, but we would hope that they would be there.
Yeah, that's our hope, is that we would be engaging CCHP in this as well. Any other thoughts here? Okay, Emily, I think you can go to the next slide.
Sorry, I have a question. I have Holly from Project Open Hand. I think one component for me that's kind of missing is, I'm certainly happy to share sort of our workflow. And I think once we get the referrals, things are pretty smooth for us. But like, I would love to know like how we could potentially get more referrals. And also as far as that transition piece, like how can we be better aware of the other providers in the network to be able to make those kind of warm handoffs that we're talking about earlier, or refer people if they do need, a longer term service or different type of service, make sure we're getting them into that.
Yeah, that's a really good call out. And I think, referrals are one piece of the puzzle, but they're not the entire puzzle. The other thing that we had talked about last month, which we're going to talk about in a second, but haven't talked about yet, is the landscape assessment that we're launching right now. And the kind of larger provider network in Contra Costa County, including capacity, is a part of that assessment. So we're hoping that we can kind of collect data to bring a more holistic picture together. So once we understand referrals, start thinking about ways that we can improve those, and then also understand that network landscape and capacity, we can kind of put the pieces together to figure out what does this collectively mean for systems change for community supports in ECM in Contra Costa County. Really good call out.
Great, thank you.
Jonathan, so your question, does this group have a list of contracted ECM and community support providers in Contra Costa County? I can say from Intrepid's standpoint, we have a tentative list. although there might be some gaps in it. And that's also part of what we're hoping to get from the landscape assessment, is to kind of confirm the list that we have. So we're happy to share that out with the group, the kind of tentative list that we have. And we will continue to share kind of results of the landscape assessment. We're hoping to have more data from that coming into the August meeting, which we'll talk about in a second, but we'll definitely be sharing that out. Okay, any final questions here or comments? Okay, next slide. Okay, so then the ask for you all is to consider signing up to work with us to map your workflow. Or if you already have a workflow mapped, send us what you have. So this conversation, if you sign up for this conversation, it'll probably be about an hour in length, might be a little bit less. And it'll basically walk the questions that we just talked through, where you'll be talking to us and we'll be on our end kind of mapping on Lucidchart or Miro a visual workflow where we can then start to analyze and put them together, understand where some of those areas that we would like to try to focus on to streamline or to help support referral processes in Contra Costa County. So there is a Google form that we will be sharing the link for if you're willing to have a conversation with us over the next couple of weeks. I ask that you please just put your information in this form. And if you have a pre-mapped workflow that you'd be willing to share, feel free to send that our way as well. Okay, next slide. And Denise, I think it's back to you.
Yep, just wanted to pause too. Is there any questions about that or any issues? Any thoughts regarding that referral mapping process? Okay. All right, we'll move forward. If we don't get any takers, maybe we'll sign some of you up and reach out. But it's definitely helpful for those that have, ideally, I think too, the second piece of that is, with each of the different community supports, how varied is the process for referrals, or is it more varied on eligibility? So that I think would be a really good thing to visualize. The next thing that we're going to talk a little bit about, and we've been talking about it in the last few meetings, is finding ways that we can collect data to measure. And so we've put together a measurement strategy, which would include data collection from all parties that make up our ecosystem or our system. And so one thing that we wanted to try to do today is have you all click on that measurement strategy survey and answer a few questions for us. And then as you're going through it, we'd also like to get some feedback from you. We will push this out to the entire PATH CPI registration list in our follow-up meeting or a follow-up email from today's meeting. But if there's anything that strikes you as not being a great flow or a confusing question, that would be really helpful to hear, and we can make those modifications when we send it out to the registration list. Anybody not able to click on the link because of a firewall?
And just a really quick kind of level set context. So the collaborative aim, just as a quick reminder, is to increase ECM and community support enrollment in Contra Costa County by 5% by the end of the year. And then there's a number of kind of bucketed areas of focus that we have said or identified that we'll be working on throughout this year, or that we think will help us in get to our aim statement. So the questions that you see here are questions that are starting to collect data on those areas of focus. We anticipate that the kind of collective data we get right now is actually going to be quite low because we haven't done a whole lot of targeted focus on this. Over time, we would like to see those increase. So there's more strongly agree responses. So if you are looking at those questions and realize that that's not where you're at right now, that's okay. It's really just trying to get that baseline understanding. But ultimately, the theory is if we get closer to the strongly agree with some of these responses, hopefully we'll get closer to meeting our aim statement goals around increasing enrollment for ECM and community supports in Contra Costa County.
Are MCPs supposed to fill out that measurement strategy survey? Or is it the community providers or other stakeholders at this meeting?
It's a good question. I would say fill it out. That would be my general response, is because you're a part of the collaborative. I think it would be good to get your data as well. If you disagree with that, let me know and we can definitely talk about it. Yeah.
Any other initial thoughts as you're looking at the questions?
Yeah, this is Jonathan. Maybe to echo Tara's comment, there's a couple questions about, contracting with other MCPs. I can't really speak to that. I'm sure everyone else has a really, really clear process. I can only speak to my own. So let me know if this approach works for you. Maybe for any questions where it doesn't really seem appropriate for a managed care plan to respond, maybe we can just go the neutral route. And then for all the other stuff where maybe we have more critical input, we can go, agree or disagree depending on the question. Would that work for you all?
Before I say yes, no, I can't remember. Emily, did we make all the questions required?
Yes, ma'am.
We did. Okay, then yes, that works.
Okay. All right. Thank you.
The other thing that we could do, especially for some of those, is we could put an NA or not applicable when we send it out to the entire registration list.
That sounds good. I think that makes sense to me. And it's going via email, right?
Yep.
Okay. All right. So we'll just wait for that and respond once it comes through via email then.
Any other thoughts, questions, concerns, ideas for improvement? Pending nothing, we'll make that change, Jonathan. And then the other thing that we would like to do, as Danny mentioned, is that we ideally want to be able to see change over time. So we'll do this today, and we'll be sending it out to the registration list sometime next week. But we'll also try to come together and complete this again in September, and then again in November. So just kind of putting that out there, that we'll try to bring this survey in its same format back to the group an additional 2 more times before the end of the year. Anything else before we look again at our network landscape? All right, okay. Go ahead, Emily, then, and bring us to the next slide. So just to recap, and I know we've talked a little bit about this today, but in our last month's meeting, we put together a network landscape assessment, and we asked the group to give us some feedback And then we asked for a few folks to pilot. So I know Rachel, I didn't see Rachel on the call today. Jonathan, thank you for your feedback. We also got a good amount of feedback from Rachel Lewis, and we were able to make some of those changes. So for today, I would love to get folks feedback on those changes. And then this is, again, is something that we're going to talk about sending out to the entire collaborative as well. And then sharing further in order to get a sense of the network that sits maybe outside of the formal registration and participants within the collaborative. So where we are today is that little, I don't know if that's on the, yeah, that little red push pin, which is where we would like to send the survey out to the full CPI collaborative list. We would also like to share with you all an email script for those partners that you work with that maybe aren't part of the PATH CPI collaborative, but you know that they're providing services in the county, and they don't necessarily have to be contracted providers. That would be helpful for us to really get as broad of a network map as possible and as complete as possible. I mean, obviously it's not perfection, but the more that we can do to add additional folks to the network assessment would be really helpful when we pull all of that together and package and display that map back to this group. And then also use that to help inform some of the other conversations around gaps in the network, around referral mapping, and ways that we can increase referrals, looking at eligibility and alignment for service providers. So if folks want to click on that link and take that network assessment, if you've already taken it, we can cancel out, just so you know, we can go through and cancel that out. So if there's concern around duplication, we're also going to post this on our website so that if you are emailing folks to encourage them to participate, you can direct them to our website if you prefer. We know that some folks may be could get multiple outreach. We can obviously share our PATH CPI registration list with you all. It's something that we have done in the past and we can continue to do. And then I think the other thing is, how else could we collect this data from folks who are not, in the meeting today? So if there's other things that we might consider creatively to collect this data outside of emailing and encouraging you all to email them directly, what might those be? And does anybody have any suggestions on ways that we might be able to collect that data?
And as you're thinking about that, just kind of zooming back a little bit and just doing a quick reminder on the intent of this. So the assessment, as Denise mentioned, is both for contracted and non-contracted providers in Contra Costa County. So we're really trying to get that full kind of assessment of the landscape of who's providing ECM or community support like services in Contra Costa County. So if you're not yet a contracted provider, are you interested in being one? If not, why? Because that's really important information to have as we're looking at the ECM and community support system of care, and helping to kind of remove some of those barriers where it makes sense to remove barriers to contracting. And then for those contracted providers, what services are you contracted for and offering, and what's the capacity? and what's your capacity? And the capacity question is one that came up in the last meeting of really wanting to understand current contracted network and the capacity of providers so we can better understand kind of the where services can flow. I think, Holly, to your point of that's kind of a next step after we do the referrals is then how do we kind of increase overall capacity or increase overall enrollment where needed. So it's really kind of twofold. It's understanding non-contracted providers and barriers to contracting or where they're at in the process, and contracted providers, what services you offer, and capacity and anything you want to raise related to the services you offer. So thinking about that in the sense of where else we can go or who else to share that to, are there other collaboratives that are meeting that have, for instance, like a group of providers that provide services to individuals that are housing insecure, like the COC collaborative is one that comes to mind that H3 runs. Or are there, you know, collaboratives? I don't know, Amy, if it makes sense to send this to some of the FQs with Aliados. You know, I know that there have been conversations there, but does it make sense to include them in this survey? Are there other collaboratives or groupings of organizations that might want to fill out this survey or might be helpful to have that data? So.
Yeah, I was going to reach out to them before filling it out to see if they wanted to do it individually or if they wanted us to do it for them. So I have it saved and we'll reach out to our health centers.
And I can speak on behalf of H3. We're the COC lead and can most definitely push it out. And I know there's a lot of work happening right now with home base. And I just got an email from them right now asking very similar questions. I think there's going to be a roundtable in August that is soliciting very similar feedback. And so perhaps we can look at, you know, how we can align the two requests and asks so it makes sense, because they might be wondering, like, home base is asking, Intrepid's asking, and, you know, who's who and what's what. But yeah, most definitely we can push this out to our provider list.
Yeah, thank you for that, Jenny. And definitely happy to align where it makes sense to align. We understand that people are asked to fill out a million different surveys related to Calium right now, coming from a lot of different people. So the more we can align and leverage what's already out there, the better. And likewise, we're happy to share our data if it makes more sense to align around this survey. Happy to work with home base on that.
The other thing that we'll try to do to make it fun is have a raffle at our August in person where we can draw from that a name and give some sort of a prize of unspeakable value. We know that gift cards are a little tricky for different folks, and so we'll try to be cognizant of that. But then also, you know, just to try and encourage participation overall. We can put that, and that'll be included in the email scripting for you all as well when you push out to additional partners. Any other thoughts on the network landscape and the map? So just to kind of give folks a timeline for the network assessment, ideally, we would like to push out the network assessment sooner than later and have it for the PATH CPI folks to discuss in August. We don't know that will work. So another thing to just kind of put out there is that ideally we would love to push out the network assessment and have it return back. The deadline would be the first week in August. So that is roughly, I think, 2.5 weeks. Just wanted to get thoughts on that. Do we think that that's enough time for folks? Thumbs up or thumbs down? Okay. We'll leave it at that for now, but if you, as you're out and having conversations, if you feel like more time is needed, please let us know. I mean, the whole objective of this is to have the data to be able to bring it back and display it, but also to have the data and be able to bring it back and display it. And so, you know, trying to be, you know, cognizant of a turnaround time that seems fair and reasonable, but still allows us to push out, you know, emails to encourage folks to complete the network assessment. Okay. All right. Next slide, please. Upcoming communications, what's happening next for August, the in-person meeting. So we'll be sharing some additional information now that we've hopefully solidified a date and time. Lene will get something scheduled with you next week to go through the logistics and share that out with folks so that we can get promotional publications out there to hold the date. Will likely require registration because we also want to be able to provide snacks and stuff like that will help us in planning. The network assessment and email script will come out shortly. And the referral volunteer form will also be included in our follow-up email from today. And then in addition to that, the measurement strategy data collection survey as well. And then our in-person date will be either the 28th or the 31st. So be on the lookout for that communications as well. Okay. I think that's everything for the day. We have a little bit of time left. We can give you all 20 minutes of your day back. Unless there's any closing questions, thoughts, concerns. Okay, don't tell anyone that you're not in a meeting right now and use the time either for you or your inbox. Thanks everybody for an engaged discussion. Really excited for the in-person next month and to continue our conversations.
Thanks, everybody.
Thank
Take
you.
care.
Ready. Bye.
Bye.